So it starts with chapter 4, section 4, actually, that it addresses comprehensive medical evaluation and assessment of comorbidities. And we have a section in there dedicated to person-centered collaborative care. It's all about shared decision making with a person with diabetes. So a clinician like myself, I'm a registered dietitian, certified diabetes care education specialist, or a physician or provider. We are in a position not to necessarily develop a plan for you, but with you. So it's always a collaboration between a person living with diabetes and a clinician. And then chapter 5 it gets into more of a behavior change and the daily life and what we can do and to make your life living with diabetes more productive and enjoyable. So it focuses on facilitating behavior change overall to improve care outcome. But it's all of those two chapters are dedicated to person-centered intervention. And chapter 5 gets it into details on how we do it. So we focus on how do we help person with diabetes adjust their medications, and how do we work with you to help with coping with diabetes, nutrition, physical activity, acute risk management, hypoglycemia, or chronic care. So it's just holistic approach to addressing your daily routine and daily habits, and creating more understanding of what you can do as a person living with diabetes and how we can help with your journey. Yes, so we have a patient-friendly standards of care for people with diabetes. We officially call it Your Rights and Care Standard, a guide for people with type 2 diabetes. We don't want to call it standards of care for people with diabetes because it's going to make it confusing, but it is pretty much um, uh, the same information that you see in our standards of care for healthcare professionals, but we converted it into content that relates to all of those clinical interventions. So you can get that guide and then be aligned with your providers or healthcare professionals to help with the conversation of understanding about the risk reduction, about overall management with medication, nutrition, and all of the things that you find in the standards of care for people with for healthcare professionals. That content aligns with the Knowing Your Rights and Care Standards, a guide for people with type 2 diabetes. We are in the process right now of developing the same version of it, but for people with type 1 diabetes. So stay tuned. Sure. So the good news is the term, as we all remember, diet. There's no such a thing as a diabetes diet. It's really a diet. The word diet is also not used very commonly anymore. We call it nutrition or healthy eating. Diet is associated more with restriction and with weight loss. And living healthy with diabetes is about having a healthy relationship with food, joy of eating, and then eating foods that nourish us, make us feel stronger, and then make us feel energetic on a daily basis. So we work with people with diabetes on making choices or selecting different ways of living that fit into their lifestyle. Right now, there's 7 eating patterns that are proven to help with glucose management, decrease cardiometabolic risk factors. So we have different patterns like Mediterranean diet. I shouldn't call it diet, Mediterranean meal plan, low carbohydrate, very low carbohydrate, dietary approaches to stop hypertension. So there is a different way of eating that needs to be individualized based on people's preferences and what they like to eat, and making healthy substitution, not necessarily restricting or removing things, but really accommodating what your needs are, short term and long term. So physical activity is the way to look at physical activity is the way that we look at eating or sleeping. It's we do it every day, so the physical activity becomes our way to monitor, to manage blood glucose. We all know that moving helps to regulate, lower the blood glucose, makes us feel better. So with diabetes, like any other condition, or without, even for individuals who are healthy, without diabetes, it's all about daily movement. It's not necessarily about intensity, is more about being consistent, and then working with appropriate healthcare professionals to determine, the intensity and the duration. But the main focus is do it on a daily basis, so it becomes part of your healthy living routine. So I was very happy to see sleep making it into the standards of care within the last few years, because interruption in good sleep can negatively impact our blood glucose. It can increase it and make it difficult to manage because it contributes to insulin resistance. And it's very linked with hormonal changes in our body. So people with diabetes wake up to high blood glucose, low blood glucose. It's very difficult to manage. So good sleep, a good quality of sleep, a good sleep hygiene is as important as healthy eating, as physical activity, as medication taking, because it has a direct impact on our blood glucose. I'm happy you're asking this question, because diabetes education works as good as medication. So we always talk to people about medication, healthy eating, and so on. But when you think about DSME, diabetes self-management education and support, we are your partner in helping you to get where you want to get to feel better, to be healthy. So we are with you throughout the whole journey of living with diabetes. So diabetes care education specialists such as myself, we work with you like at diagnosis. That's number one. Number two is annually, whenever you're not able to meet the glycemic or metabolic goals, then we are here to reassess the care and then help you to achieve those goals. And then number three is when complicating factors arise. So when we develop, let's say, a kidney condition or heart problems, then we look with you on your diabetes care uh, routine and then medication and all the things, and help to adjust it accordingly. And finally, number four is when major transition in care occur. Like, for example, people go to college, people become empty nesters, people get divorced. So that has an impact on the self-care, and consequently impacts the way that people with diabetes can manage the diabetes. So we are, as a diabetes care education specialist, with you throughout the whole journey. And so think of it as not one-time visit with a diabetes care education specialist, but we are your partner in your journey. I think that the one message would be that if you plan with diabetes management changes, it's actually a good thing. It's a responsive care. So it's very normal and expected to modify the way that you approach diabetes, to change medications, to change the way that you eat. So it's really a very responsive care, to be prepared to be able to manage it and change it.